But hello, everybody. Welcome back to another session of WESTalks. This has been going on for over 8 months now, and thank you so much for joining us week in and week out. By now, you probably already know that WESTalks is brought to you by IC Impacts and UBC Future Waters. IC Impacts is a pan-Canada-India research collaboration for research in the field of water and infrastructure. And UBC Future Waters is an interdisciplinary water cluster which focuses on interdisciplinary research in the intersection of law, policy, and governance, which again relates to water research. This is also something that we wanted to talk about, which is the West Conference. It's happening from June 9 to June 11 at UBC, but it's virtual this year, so it becomes easier for you to join no matter where you are in the world. So if you're interested in attending the conference and listening to some great speakers, I believe we already have Dr. David Sedlak as signed up as our opening speakers. Please make sure you register for the conference or even submit your abstracts. This is the wonderful team members that I've got the chance to work with for the last 1 year. There's Layli Apkar, Fuhar Dixit, Carl Zimmerman, Jessica Ndiman, who have been working at this for the last 1 year, and there's Feria from IC Impacts, who's been helping us with the website and also communications. This is something we've been putting up every week. This is the reads that we've actually been able to gather over the last 1 year, and makes us really happy to see that our viewership has really grown outside of just Vancouver and North America and really reached out to different cities across the world. And we probably need to contact those researchers in Antarctica because that's the only continent that we have left to reach out to. This has been a great lineup of speakers already this spring, and we're going to be going all the way till June 3rd, right up until the West Conference. But today we have Dr. Priti Parekh from University College London, and she's going to be talking on the role of infrastructure, including sanitation, for human well-being and links with SDGs. Right before I introduce our speaker for today, just a reminder, if you missed out on any of the talks the previous few weeks, you can always go on the IC Impacts YouTube page and check them out. And finally, it's my great pleasure to introduce Dr. Parekh, who's been very swift with her communication, and thank you for that. Dr. Priti Parekh is an associate professor at the Bartlett School of Construction Project Management, where she heads the Engineering for International Development Center. She has substantial industry experience in South Asia and the UK on infrastructure design and delivery. She has led research in cross-sectoral partnerships to improve access to water, sanitation, energy infrastructure in resource-challenged settings, such as slums and remote villages in South Asia, Africa, and Latin America. Her research is interdisciplinary, with solutions co-developed with local community and policymakers. She is a fellow of Institution of Civil Engineers, chair of the editorial panel for ICE's Engineering Sustainability Journal, and was a board member for Happold Foundation and Engineers Against Poverty. In 2019, Dr. Parekh was recognized as an Engineers Without Borders changemaker as well. She was awarded a prestigious fellowship co-funded by industry and Royal Academy of Engineering to address energy access challenges in sub-Saharan Africa. She engages with media through her ongoing British Science Association Media Fellowship and is passionate about inclusive engineering. And before I hand it over to Dr. Parekh for the presentation, just a reminder, if you have any questions, please ensure you put them in the chat box and we'll get to them at the end of the presentation. Thank you, Dr. Parekh.
Thank you very much. And I just want to say it's such a great initiative. And I was quite impressed when you showed me the slide demonstrating global outreach of your talks. So it's wonderful. And thank you very much for inviting me to be part of this group today. Now, let me see if my technology works. As always, that's the burning issue nowadays. Yes, it does seem to work. Wonderful. So, I think in a way, Abhishek, you did a great introduction, but I wanted to provide a bit more framing. And just to say that as a school in Bartlett, we are also in the process of rebranding ourselves as the School of Sustainable Construction. So the idea is that we're moving away from just project management to think more broadly about sustainability in construction, in infrastructure, to embed in principles of net zero, climate change, and other broader issues. And this rebranding is in process. It's happening next week. And I also moved out of my engineering faculty to the faculty of Bartlett, as our work gets even more interdisciplinary. So as an engineer nowadays, I tend to work more with those who are outside the engineering kind of domains and boundaries, and I will explain why. So I had the Engineering for International Development Research Center at UCL, where we use mixed methods to address global challenges. We've got a couple of research areas and themes that we are interested in, which include resilient and sustainable infrastructure, both water sanitation and energy. I'm going to concentrate more on our water sanitation work today, given the audience that we have today, but we've got a whole body of work on renewable energy. And I have this big fellowship with Royal Academy of Engineering, where we look at improving energy access in sub-Saharan Africa through solar energy solutions. Then we look at interdisciplinary interventions for human well-being, mapping synergies and trade-offs between infrastructure and sustainable development goals, which is something I would like to kind of cover a bit more today, gender inclusive infrastructure, and also my roles, external facing roles. So the reason why I got into development is partly this frustration. So I grew up in India, in Gujarat, the western part of India, and funnily enough, I've spent half of my life in India and half of my life in UK now. And my parents grew up in East Africa. So in a way, I'm neither here nor there. But the big frustration I had growing up in India is, on one hand, in India, you've got the finest engineers, the finest engineering institutions in the country. It's not that we lack engineering knowledge, know-how, and credibility, but it's a country of contradictions, where on one hand, we have advanced kind of research when it comes to, say, space and science and technology. But on the other hand, we've got millions of people who do not have access to very basic water sanitation services. And for me, this was a big frustration. And this is what got me interested in development. I mean, this is a portrayal by R.K. Lakshman, who I think was in one of India's finest kind of cartoonists. And he had this ability of putting forward the perspective of the common man. And I mean, if you look at some of the water sanitation solutions which are implemented, I mean, this public toilet is the biggest source of frustration, because in a way it poses an even higher environmental and health risk. Or if you look at this water source point, it does. And somehow there's this notion often that if you work in low-income settlements, the solution has to be poor, it has to be kind of suboptimal. But I argue that we need better solutions, higher quality solutions, for those type of settings. And also, I mean, from a gender perspective, I mean, a lot of women and girls face harassment of some form or shape when they try and access public toilets, which are not well lit, not well designed. I mean, in fact, I was looking at stats more generally for women and girls in public spaces, and more broadly in public spaces. There are some cities where 9 out of 10 women feel unsafe using accessing those public spaces. And there was a study in UK recently where 70% of women in UK felt unsafe in public spaces. So the last thing we want to do is kind of create further spaces or create infrastructure in spaces which adds to this insecurity. And I mean, this kind of a lack of access to basic services also extends to electricity access. And this is an image from a township in South Africa, which are kind of in the slum is in the township is in the city. So technically or in theory, they are on the grid, but they are off the grid. And then they come up with their makeshift solutions for accessing electricity. But there's a huge health and safety risk here. And I mean, throughout my career, I have argued, especially for cities and high density settings, the need for high quality water sanitation solutions, whether they are pipe solutions or not, but generally arguing the case for high quality solutions. Because I mean, I live in London now, and in London, if you look at the history of River Thames, I mean, it used to be the Great Stink, and now look at how services have transformed the way we live in London. And the same goes for Europe, where the highest reductions in mortality rates were recorded in the last century with the advent of safe water and pipe sewage solutions. And I've been fortunate enough to be involved in India during my early years of my career in a project called Slum Networking. And the premise of this project, Slum Networking, was to provide physical infrastructure services through networks in slums. So looking at water sanitation, but improving roads, electricity, rainwater, solid waste together. So in a way, not a piecemeal approach, but a more holistic, integrated approach. So you're not digging up the road 20 times to install a different set of services. In situ upgrading with land tenure provided as a lease, because one of the big issues when it comes to slum upgrading projects is relocation, and who relocates, who does not relocate. It's very complicated, it's very icky, it's very messy. And thinking about what, if you provide network solutions, what are the modifications you need for making them appropriate for high density settings, whether it's rethinking design of manholes, whether it's rethinking the standards and guidelines, or it's similar perhaps to the approach, in Brazil, the condominium sewer approach, where we can think of shallow sewers, shallow networks, and making solutions work for slums. But most importantly, getting out of this poverty syndrome of, oh, poor people, we are helping them, but bringing them in as financial partners so that they make even a small contribution to the cost of infrastructure, making them an equal partner, having a seat at the table through self-reliant partnerships. And then subsequently in my doctorate, through interviews and through fieldwork, I demonstrated that in those projects, infrastructure was able to have a positive impact on health, education, income, and housing. And I'll share some of this evidence with you, not the full study. I interviewed residents in 5 slums in India, and this is an average of 1 slum settlement. And I asked them what their priorities and needs were before they had access to water sanitation services and after. And the blue line shows their priorities before, and the red line shows after. And you can see that previously residents prioritize the need for water sanitation, roads, electricity, i.e. kind of physical infrastructure, basic services, which they needed to access on a day-to-day basis, and which was a huge challenge for them. But as soon as they had access to networked water supply, sanitation, their focus shifted to then thinking about housing and land tenure and health, education, employment. A lot of people get surprised when I present this because there is an assumption sometimes that people would prioritize employment. But the reason that in this instance, people prioritize water sanitation was that they felt if they had access to those basic services, it would free up their time, it would free up resources and enable them to go and seek employment to improve health and so forth. So basically, I argue that infrastructure is an enabler because it shifts needs and aspirations from very basic needs to improving quality of life. So there is this shift from lower order to higher order aspirations as a result. And in the settlements that I studied, the first 3 communities, Ramdanagar, Sanjaynagar, Pravinagar, are communities where water sanitation infrastructure was provided, and the last 2 were more controlled, where those services were not provided. And I saw an increase in household expenditure. I tried looking at incomes, but it was very, very difficult given the informal nature. People were reluctant to share their household incomes as expected. So I looked at monthly expenditure and saw that there was an increase in expenditure and disposable income in the service communities. And this is an aerial, this is a visual from a settlement in a slum in my hometown of Ahmedabad in Gujarat. And you can see that there is a difference in housing stock. And what happened in the settlement is after water sanitation services was provided, over a period of 7 to 10 years, residents started to invest their own resources to gradually upgrade the housing stock. And this started from improving the floors, to then brick walls, to then roofs, reinforced concrete roofs, to buying television, to sending children to private schools. So in a way, water and sanitation started generating this investment inherent in those communities. And that started to manifest in the form of people improving the housing stock, adding another floor, also kind of new livelihood opportunities, so almost like a Swiss laundry, in a house or a makeshift shop. So infrastructure really became an enabler for people to move from lower order to higher order needs and aspirations. And I always argue that for me, housing is not a product, it's a process. And in a way, infrastructure and this land tenure lease meant that people could invest in housing, could invest in this process. And I looked at what the housing investment was. The way I did that was I looked at the area of the shack and dwelling, and I looked at the type of walls, floorings, and I made an estimate because the investment was quite informal. People would swap labor where a plumber would help a mason. So in a way, it was quite difficult to quantify the exact investment because it was not formally contracted. But in spite of that, I managed to get a general sense of what the investments were. And the investments, and this is kind of 15 years old now, but the investments at that time was $2,000, which seems like a small amount, but it's not that small if you kind of look at what the household incomes were. And you have to remember that this was generated from the communities themselves because the intervention, the project was just infrastructure. I asked the community what the reason was for investment in housing. And I mean, the top reason was better infrastructure, comfort, land tenure. Family size came up because a byproduct of providing water sanitation was that there was a reduction in illnesses and possibly deaths. So we saw more children in those settlements as a result. And with the family sizes increasing, there was a need for creating more space. And also what I've done is I've added a comparison with South Africa here. So I did the study in South Africa and India. I've just added this, in this slide, I've added a comparison with South Africa because it was interesting to see the safety dimension come in more strongly in the South African townships, that people felt safer if they had houses with brick walls and a concrete roof, and it offered more security, and also it was warmer in colder climate. So I looked at what the multiplier or return of investment of infrastructure is. And the blue bar shows the initial investment by the government. And then the yellow, red, colorful bar shows what the community put back in when it came to housing, goods, and infrastructure contribution. Now, Ramdev Nagar, which is the lower bar, the government investment was quite limited in that. In fact, the community and then UNICEF contributed to the cost of infrastructure. And you can see a huge multiplier there. In Sanjay Nagar, the government put in more investment, but still you can see that there's this huge multiplier generated as a result of infrastructure. I mean, it ranged from 8 times to 20 times the original investment. So generally, I mean, if you think about it from the perspective of government of India, the government does not have enough money to build infrastructure, to build houses for all its citizens. I mean, it's very clear if you do the numbers that that is simply not feasible. But if they were to provide the seed funding for infrastructure in all the slums and then provide support for loans and land tenure, they could revolutionize, and they could also address the gaps in housing stock. I've spent a body of my time also working in South Africa. So South Africa is also somehow a setting which is very close to my heart. And in a way, when I won this funding from UK Research Council and also from the National Research Foundation in South Africa, what we wanted to do there is work very closely with local partners, but embed that research within the community. So we developed this network of community researchers from 3 settlements that we work with. So when you look at the research team here, it's not just the academics from UCL, University of Westminster, and UKZN, but you also see researchers who live in the community being part of the project, and they informed the development of the tools, they helped us with data collection, but also they were very much part of our impact and outreach and dissemination. And in that project in South Africa, we looked at different settings. So we looked at Pisang River, where there was an in situ upgrading project. which was successful. That project included infrastructure and included housing. And similarly, Namibia Stop 8 is a settlement which had housing and infrastructure. I think the difference between Pisang River and Namibia Stop 8 is that Pisang River is well established. So that settlement has been around for a longer period of time. And then the third one that we picked is Havelock, which is interesting because it's a hilly terrain, no household infrastructure at all. There's kind of ablution blocks, toilet blocks at the top and bottom of the settlement. But it's a very difficult settlement to navigate. So you have electricity cables open on the ground, very narrow access points, hilly, gets flooded. So a very tricky settlement. And we thought it'd be interesting to compare and contrast kind of living conditions and perceptions of infrastructure in those settings. And in Namibia Stop 8 and Pisang River, where water was provided on a household basis, interestingly enough, water supply was still an issue. A lot of households were very unclear about meters and water consumption and billing, and they kind of had the sense of they were being ripped off. So there was this really kind of clear lack of communication and clarity on how they were charged for water services. A lot of them had installed flush toilets, but the water supply often was erratic. So then they had to go and find source water in buckets and bring it back. So there was still this kind of gap in service due to erratic water supply. The government also tried to install rainwater buds and encourage rainwater harvesting. There seemed to be a very strong interest in urban farming. So all the women especially had knowledge of farming techniques, and they were very, very interested in scaling up urban farming solutions. But I think the difficult conversation to be had there was that they wanted the government to provide water at a lower tariff or water for free. And given the water scarcity, that did not seem to be feasible. So there's kind of a lot of debate and discussion around how water can be used for urban farming. Even in those settlements with services, water, sanitation, education, solid waste, electricity were identified as priority areas. Havelock was extremely challenged setting where you had a stream which was clogged with solid waste management. In fact, in terms of baby wash, there are a lot of nappies being disposed, just thrown into the stream, for example. So this is whole added chain of infection. And water, housing, electricity were identified as top priorities. And households said they were willing to pay for household services, especially they looked forward to water for hot water baths, and they looked forward to having toilets in their households because there was one custodian or guardian who had the key to the community block, but in the night they would have to go and find this person to access those toilet blocks, which was not convenient at all. But overall, there was a need for integration of services and departments. They all felt and agreed that the community-driven processes are sustainable, but there was a need to look at resilience in a multi-hazard setting. And there was an interest in recycling and reuse of waste, the circular economy approach. I'm going to now move on to some of our work on sustainable development goals. So we were commissioned 3 years ago to identify links between sanitation and sustainable development goals. And the reason for that was to make a case to policymakers to allocate more resources to sanitation. I mean, as we know, this is a sector which suffers from underinvestment consistently. And I mean, my big worry is that with COVID, I hope that this does not continue. In a way, I argue that with COVID, there needs to be further investment in this sector. So we were commissioned to look at the evidence base on linking the two. And the first part of the discussion, which was a very robust debate within our interdisciplinary team at UCL, and in our interdisciplinary team, we had expertise from health, environmental law, planning, architecture, engineering. So it was a very diverse team. And the first big debate we had is what is the best practice of sanitation? And we looked at definitions by WHO, UNICEF, and we came up with kind of principles that it needs to be equitable, it needs to be for all, so it needs to be inclusive. We need to look at ending open defecation. We need to include and consider needs of women, girls, and other vulnerable groups. But most importantly, it needs to be safely managed across the sanitation value chain. And what we did is we looked at over 600 academic publications, And for those publications, we posed the following question. Does the target call for action in relation to sanitation? Are there synergies between sanitation and a target? And are there trade-offs? So if we provide safe sanitation, which is what the definition framework is what we use, are there any trade-offs? So is there a negative impact on any of the targets? So we did this exercise for all 169 targets. And this is what we found. So we found that there was action needed for 83 targets, but most importantly, we found that there were synergies between sanitation and 130 out of 169 targets, which is quite striking in all 17 goals. And there were trade-offs, a few trade-offs, and I will discuss them in detail. And we kind of categorize our findings and results under the headings of individual and collective aspirations, environment and natural resources, infrastructure services, innovation, and then kind of partnerships. But for me, the fact that sanitation has kind of synergies with 130 targets is very, very striking, because this is a case to be made to policymakers of, well, if we invest in sanitation, it's not just about improving the infrastructure, but it could benefit and influence ministries of health, education, and a wide-ranging sectors. It has an impact on climate change. So we found that there were synergies with 77% of the targets, and most of the synergies were around inclusivity, social diversity, and human well-being. And also, when it comes to the environment, safeguarding water systems through treatment and disposal, the waste energy nexus. Also, there were synergies with regards to kind of disease reduction, safeguarding ecosystems or supporting livelihoods, and integrated action for climate. We looked at trade-offs. They were small in numbers, but there were trade-offs with providing sanitation systems. I mean, simple examples were, if you provide flush toilets, you are promoting water-intensive systems. So it could be that a government increases access to sanitation, but the trade-off is water scarcity. For some households, it increased kind of the burden, and it meant there were challenges around affordability, government taxes. Quite often, and we found this to be a common theme, there would be a mismatch between aspirations of what international development community felt was good sanitation or what was appropriate for the context versus what the community felt or what they needed. So this mismatch between kind of international development and kind of local needs and aspirations came out a fair bit in our literature. And also trade-offs with hygiene education, because if you do not have hygiene education, you can provide the sanitation, but so what? So there were some interesting trade-offs which came out of our work, but predominantly we saw a wide range of synergies. So this study identified synergy links between sanitation and all the SDGs, and synergies were at multiple levels as well. So individual aspirations, household, community, society. And it's about improving access to infrastructure, but also benefits other sectors, and interconnected and far-reaching benefits from sanitation. And at that point, we decided that we've done this global evidence review, but it'd be interesting to also now contextualize this, because I mean, one can argue that this is all well and good, but how can we contextualize it? How can we rationalize it and measure it in our context setting? And also, every context is different. So we did a similar exercise for Brazil. What we did in Brazil is we dug a bit deeper and said, okay, if we provide sanitation, how does it further interlink? Because if we use the systems thinking perspective, I mean, we live in a world which is very complex and messy. And so it's the case with sanitation, that there are multiple and complex linkages within the SDGs, but between sanitation and the SDGs. So what we try to do here is also map and be more explicit about those links and benefits that sanitation could leverage between various SDGs and how they better link them. This work is available. This has been published. So I've added the link to the publication if you wanted to look at it a bit more leisure. But this is to demonstrate that sanitation is vital. I mean, I'm going to argue here it's almost non-negotiable for achieving the Sustainable Development Goals. COVID, in a way, adds another complexity to this issue now, because my worry is that with COVID, is there going to be an further underinvestment in the sector because resources are scarce. And at the moment, governments are really focusing on investing in COVID recovery and vaccines. There's a huge demand and push for resources. What we did here with colleagues in India, and this is work done as part of the CHIP consortium, which is looking at childhood infections and pollution. So the idea with the CHIP consortium is that we as a collective, as an interdisciplinary group, we get together and we explore issues, broader issues, One Health issues in relation to child health and nutrition. And what we did here as an exercise is we just visualize, if you're living in a slum, how difficult it would be to kind of practice social physical distancing and all the contact points just to access water sanitation on a daily basis. I mean, you can see that lockdown is not possible if you have to go out of your dwelling every day to queue up for public toilet, to queue up to get access to water. And this is just to add why WASH is even more important in the light of COVID, because hygiene, I mean, is one of the key kind of barriers, one of the points of defense in COVID. And we've published this work to kind of indicate what the links between COVID, WASH, and SDGs are. And part of it is more the emergency short-term measures. Part of it is the more continued access to WASH facilities, but also monitoring of waste water to look at traces of virus, but also thinking about linkages with inequity. Because in a way, what COVID has done, it has further exposed and laid bare inexisting inequities in society. And this also includes gaps in water sanitation services. And those who have had the gaps in water sanitation services, it has been very difficult for them to observe the hygiene rules, which are crucial for COVID. I mean, how can people wash hands if they do not have access to water? We kind of did a similar exercise for energy, which I wanted to share. Very similar results. I mean, this is a global mapping exercise. I was part of a large consortium interdisciplinary team at UCL. And we found that there for energy systems, there were synergies between energy systems and 143 out of the 169 targets. So similar synergies were noted between energy systems and the Sustainable Development Goals. We then tested this approach for a case study, a more focused case study in Rwanda, which is the table you see next to the wheel diagram, for the off-grid solar sector. And we found synergies with about 85 of the targets. So once again, strong synergies and a case to be made for investment in the off-grid sector. So as a center, we specialize in this type of evidence-based work. We are currently advising WaterAid, and we're working with WaterAid to develop a ministerial policy brief for the African ministers to make a case for investment in sanitation. We are also working in Durban with Equity Municipality to help them better monitor progress towards achieving the Sustainable Development Goals. And that involves looking at various indicators, but building on our evidence base to prioritize indicators that they need to measure and think about how best they can capture this evidence. In our work, we make a case for harmonizing investment in action. So basically going to the Ministry of Education and Health and saying, well, you need to invest in sanitation. So you need to, for example, improve WASH in schools as part of improving education. You need to improve WASH in health clinics and trying to harmonize investment as a result of our work. This also demonstrates the need and the importance of interdisciplinary working, because to do this type of evidence-based research, you need an interdisciplinary team to work together. You need expertise from health and environmental law and policy and planning and geography. You need that expertise. During the global mapping, it was clear that we do need to look at context-specific case studies. It's not one size fits all. And the Nexus approach came out really strongly, the need for kind of a circular economy, Nexus approaches, where we can really look into the use of wastewater, for example, safe use of wastewater. And our work here, the aim of the work is to kind of foster cross-sector collaborations, so collaborations between public-private sector, between academia, industry. So the idea is that this is a problem, big problem, and we all need to chip in and work together to solve this problem. And more generally, I mean, in our work, we kind of, when we think about creative engineering, these are the principles that we broadly incorporate in our work, whether it's infrastructure design, whether it's SDGs, whether it's energy access, and that is around sustainability. So sustainability is at the core of what we do. Interdisciplinarity is very important in our center. The multiplier effect, so what are you achieving out of your research? What are you achieving by providing the infrastructure? We are finding that simplicity is very, very hard, but simplicity is important. Sometimes it's harder to design a solution which is elegant and simple, but those are the solutions that often stick, especially in settings where operation and maintenance is going to be very tricky and challenging. The solutions need to be appropriate for the local context. Engineering is here to improve human lives, so thinking about how we can do that whilst conserving natural resources. So frugality is something we really bring into our work. So we work in very resource-challenged settings, and we are mindful of that. So we always look at conserving resources. And for that, we look at innovation both in the product and the process. So for example, with housing, for example, generally, I do not work on projects which enable housing, because the idea is if we can look at land tenure, if we can look at infrastructure and other kind of points to leverage investment in housing, that is far better and more pragmatic. And I mean, the most important one is we look at self-reliance and we look at localized solutions within the country. So I'm going to stop here because I wanted to keep time for discussion.